Good morning, good afternoon, good evening, everyone. This is Patricia from the International Hospital Federation. Welcome. I hope you're all safe and well, and thank you very much for joining us today. We are hosting this COVID-19 webinar and live Q&A series to share experiences, good practices, recommendations, and insights from our members and other organizations across the globe. The series has been created with healthcare providers for healthcare providers, including decision makers and those involved in managing COVID-19. We hope the lessons you take away from this webinar will help you in facing the crisis and beyond. I would now like to introduce our moderator, IHF CEO Eric de Rudenbeck. Eric?
Thank you very much, Patricia, and welcome everyone to our webinar that will take us today to Jordan. In this current period of COVID, it's certainly not best to be on the headlines because, you know, it's often about giving bad news, but it's not because a country is not visible in the international media that it did not also have to face COVID. Because headlines and media have appetite to share a rather sad story than success stories, with this webinar series, we really want to cover the responses that have been providing good support to respond to this situation. We will cover how in Jordan, in a province, the province of Irbid, there has been a success story in the response, showing how also in the region, the Middle East region and in middle income countries, it's possible to change the way organization operates to respond to a new condition. So beyond these very specific actions that have been taken to face COVID, this will give us an opportunity to hear about the importance of decentralization in situation of crisis and how a crisis may be reshuffling the roles and responsibility for health service delivery for the next normal situation. So before introducing our speakers, we'll have two speakers today. I really also want to share with you our pride as IHF and for the community of members to have the community of hospitals from Jordan, both public and private, and the public is also including the army, supported by the Jordan Healthcare Accreditation Council that has been doing an extraordinary work in this country and for the region. Now let me introduce you the two speakers in the order they will come in for the webinar. First, we'll have the chance to hear Professor Wail Hayajneh. He is Professor of Pediatric and Infectious Disease at the Jordan University of Science and Technology in Irbid, Jordan. And he was before a dean in this university. He's also the chairman of the National Immunization and Technical Advisory Group for the World Health Organization. He has served as Deputy CEO at King Abdullah University Hospital, and is also a board member of the Jordanian Higher Education Accreditation Commission. He is a member of the Jordanian National Epidemiological Committee, where he serves as a member and rapporteur of the Executive Committee for COVID-19 in Irbid. So definitely, we cannot have a better person to tell us about the situation in relation to COVID. In addition, after him, we'll have the great opportunity to hear Salma Jaouni, who is the CEO of the Healthcare Accreditation Council organization I just mentioned. It's really a great pleasure to have you on board, Salma. She was before that the senior advisor to the Jordan Prime Minister on public and social policy, after serving as the founding director of Jordan National Breast Cancer Program. She also worked with Booz Allen Hamilton, the World Bank, USAID, in MENA Consulting Public Health, Social Service Initiatives, many other also activities with WHO in the region. Salma holds a Bachelor of Science from American University of Beirut, a Master of Public Administration from Harvard Kennedy School, and postgraduate diploma in health services from London University. She's a ISQA board member, experts, and serves on several national and international boards and committees. Her accomplishments have been recognized by several awards on leadership, and we are very proud to have you also today for the webinar. Professor, the floor is yours for the first presentation. Thank you very much.
Thank you, Eric. Good times because there might be morning or evening or any time anywhere in the world. Thank you very much, Eric. I promise I will pass a nice story today from Jordan. I am very honored to have CEO of HCAC, Salma Jaouni, with me. And if you would see this hospital, this is my hospital where I work, King Abdullah University Hospital. This is the only recognized hospital in the north of Jordan to receive COVID patients. This is JCI accredited and HCAC accredited, long-standing accreditation. We are proud of the quality that we provide by the help of HCAC and JCI, of course. So as this said, Eric, today I will be going through the epidemic situation in Jordan. What are the opportunities and challenges that we have been facing here? How did we go over these challenges? And I'm gonna take Irbid experience, which is a governorate in the north of Jordan, as a prototype of how did we work in Jordan, when did these things start to unfold in Jordan as part of the world. And of course, during this story today of 15 minutes, I will claim that there was a success story, and maybe there is also some failures that we have to admit in order to do better work in the next pandemic. If it comes, it will come sometime. So as this said, let me start. Jordan is no exception to the world. And I have here to start with the early choices that we have made in Jordan starting February to 2020, when the epidemic committees, after assessing the resources of Jordan in coordination with Ministry of Health and supervised by Ministry of Health, as the epidemic committee is chaired by the Minister of Health in Jordan, they decided, or we decided, that in Jordan, our resources, despite the very highly qualified human resources in Jordan, we cannot afford to have an exponential increase in numbers in COVID-19 in Jordan. And that was the other ethical responsibility, that according to social values in Jordan, we cannot keep it for herd immunity issues that was done by certain countries around the world. So we decided very early that we have to go for a very harsh, very strict, very striking containment process for COVID-19. And I think to start with, that was the beginning of the success story, but it was also the beginning of a lot of challenges that we have to deal with during the story of COVID-19. Let me start with this slide, my friends. This is just to put the whole situation in the perspective. This is the regional perspective of where does Jordan stand in this epidemic or pandemic. If you look here, the average, this is just 2 days ago or 1 day ago, the average per million around the world is 900 cases per 1 million around the world. Jordan is 81 per million. Qatar, which is just 1.5 hours from Jordan by flight, 24,000. Folds and folds and folds increase. This is a lot of challenge. We've done a lot of good things in our containment process. We are here at the bottom. We're glad to be at the bottom when things come to this situation. And Qatar is here. However, Bahrain, Kuwait, I'm going to show you the next story here. If you look, this is our epidemic care. Our epidemic care has been flattening with some bumps and lumps somewhere along the road. However, this is in Jordan, our cases are around 850 since the beginning of the story, which is March the 2nd of 2020. However, if you look around, sir and ladies and gentlemen, Qatar, they have 70,000 cases. Saudi Arabia, 105,000 cases. In Saudi Arabia yesterday, I think they reported 3,000 something in 1 day. We reported 850 in the whole period, and United Arab Emirates 39. So, and this is a problem for Jordan. And why this is a problem? Because hundreds or tens of thousands of qualified or highly skilled Jordanians are maintaining processes and life, medicine, whatever you name it, in these countries. And these people usually they return for a summer vacation in Jordan, which they are waiting for these 2 weeks or 3 weeks or 4 weeks. You can imagine how much pressure now on Jordan, on the government, on the epidemic committee, on everybody. How can we afford to let these come to Jordan when, as Salma said in the beginning, during the 15 minutes break in the beginning, that the most important problem we have in Jordan now is across the borders, not inside Jordan, because we have managed to flatten our curve and to keep our community spread at the minimal cost. So this is an opportunity, this is a challenge that have been created by our containment process in the beginning. So by going, this is Jordan. Jordan is made of 12 governorates, and one of these governorates is Irbid. This is Irbid, where I live. It has borders with occupied Palestine, it has borders with Syria, and it has borders with Iraq. So this is a border governorate in Jordan, and with a lot of universities and students, and a lot more than 2 million population, and Jordan is a 10 million population. Along that, we have almost more than 300 residential areas in Irbid. 2 refugee camps, many villages, small towns all over the area. And it is highly populated. It's not that there's something that's populated and the other is not populated. And that's the prototype that I'm gonna be talking about today. This is the curve of Jordan for daily confirmed cases. In the beginning of the situation, we have a case that was traced back to Italy. Then we have a case that started the wedding, the famous wedding in Jordan, which came from Spain. Then we have these cases related to drivers, but at the end of this period, as of today, we are dealing with cases that are related to drivers, truck drivers, that are crossing the borders from Saudi Arabia, from Qatar, from Dubai, or all of them together, actually. Our drivers, they go on one trip to all these countries. So these are, however, this whole situation is about 850 cases. While if you look at Irbid, which is the northern governorate of Jordan, you will see that there are many periods where they were free of COVID-19, confirmed cases of COVID-19. So if you look at the total confirmed cases and you subtract the numbers of those from Irbid, you see that Irbid, since the end of the wedding story, which was March 26, March 27, we are almost having a very flat curve, while the situation in other parts of Jordan, they continue to climb. But again, this is a flat curve, but not as flat as the situation in Irbid. But to be fair, these numbers are also made of drivers that have been also discovered daily. Daily, we are discovering 6 to 12 cases of drivers with COVID-19 at the border, and they are quarantined in the border. So the situation is under control. We are estimating our capacity in Jordan is to deal with 70 to 80 cases a day, and that is where we're keeping our at the current status of our resources when we talk about ICU beds or ventilators or other PPIs that are very important for this situation. Again, this is just to compare Jordan in the blue and Irbid in the red. As the time is going on, you will see that Irbid is not contributing too much to the numbers of cases that are happening in Jordan, and we will go into these story in a few minutes. So what happened in Irbid? There was a very famous wedding in Irbid that happened on March 13th, where 400 invitees were attending a wedding for a lady and a gentleman, and the father of the bride just came from Spain. And you know, Spain was the epicenter around the world at that time. He did have symptoms and he managed to go through. This is not our story. He managed to go through, and in that wedding, a few days later, the government enforced an airport closure and a lockdown along all the country. We were 4 days late for that guy who came in Jordan, who came from Italy. So and if you look at this here, at this graph here, in the beginning, the numbers in Irbid were really as much as in all other parts in Jordan. That's why when the government took a on 26th of March, the government had a defense order to form what they call it, the Executive Committee for Management of Corona Outbreak in Jordan. And this was the beginning of implementing something in Jordan that we have been trying to implement for several years, which is decentralization, the processes of the government on 3 areas in Jordan. And Irbid is one, we call it the northern part or the North District of Jordan. And this committee was formed of the governor. Here is the governor actually, and I took his permission to have this picture. This is the governor of Irbid. He was heading this committee, and it was also members of these were the director of health services in Irbid, directors of all police, army, intelligence, and there was an epidemiologist, and also a physician who was me in this committee. And this committee was mandated to be like a small government in Irbid. They were having all the mandate to do anything to keep the health issues in Irbid related to the pandemic, the coronavirus, to contain the virus, to take every necessary step to combat this disease, and also to maintain all other health issues, social issues, economic issues, and all other things related to this problem in Irbid. And this was a very new experience in Irbid, that we don't have to go back to Amman for each decision that we have to make. And of course, the expertise, I told you in the beginning, Irbid has a lot of expertise when we talk about physicians, when we talk about infrastructure, when we talk about manufacturing, agricultural, everything. So we did have the infrastructure to deal with such mandate from the government, and that things how went from the beginning. So let me talk about 3 things here. The governance in this local government, which was made by the committee that I talked about 1 minute ago. Then this governance or this local government has to deal with case management, with contact tracing and surveillance of patients and contacts in Irbid to oversee these issues by having more horizontal integration than vertical orders from the capital of Amman. So everything was taken by consensus among the members of this committee in Irbid, by not going to Amman except when we need some supplies, PPIs, medications, and following the national guidelines that come from Ministry of Health and the Epidemic Committee. Let me give you some examples about good governance that was used by this decentralization process in Irbid. The rule of law. Actually, the army did a very extremely good job in keeping the isolation of Irbid. Irbid was isolated, by the way, from the rest of Jordan. And the police did a very excellent job in dealing with the people of Irbid. So the army was keeping the points of isolation, and the police were dealing with the people in the field. Transparency was there. We were declaring all the cases. Everything we have in Irbid was made available for every person in Jordan, because we believe that this trust of people was very important in keeping our jobs going on in that district. We were very responsive. I'm gonna give you one example. Sometimes we were having a lab data that some people, some contact is having COVID-19 confirmed case in one of the residential buildings in Irbid. A decision will be taken within minutes to quarantine this building. All police, army, intelligence, and health services will be there maybe in 20 to 25 minutes. And the whole decision will be implemented in within half an hour. Imagine if we have to take the decision from Amman, the capital, these things. We have quarantined more than 50 residential areas in Irbid. And sometimes we have to quarantine even sections of the city because there are areas that were very populated in Irbid, so we have to quarantine everything. So decisions were taken within 30 minutes. So responsiveness was very high. And consensus decisions were made by immediate convening by the member committees in Irbid. Of course, equity and inclusiveness was observed in the whole situation. We did reach every area in Irbid when we talk about food, supplies, medications, contact tracing, all the processes that you have to maintain the life of the people. And I think the numbers talk about the effectiveness and the efficiency of doing these processes. And we were accountable. We did some mistakes. And we were not shy to say that we did some mistake and we did some correction actions. That coronavirus or COVID-19 is a new disease that we were learning this process along the way. And participation. One of the things that I will go out today with a message that without the participation of the civil society, of the people, of the volunteers, of the people who can afford everything they can do, we were not able to make any success in Irbid. And this is a prototype of what happened in Jordan, in the whole country of Jordan. And I'm going to show you some examples of these volunteers. Okay, so as you see, the Governorate of Irbid was isolated by the army. Police were taking care of the checkpoints in between. And there were also hotspots in Jordan where cases were there. So we also isolated the hotspots. And as I can tell you proudly, this Governorate of Irbid was changing or transforming from a very dangerous place to a safe haven in 2 to 3 weeks, actually. And the story, as I told you, the numbers and the curve from the beginning. If you look at these are just a quick description of the small outbreaks that happened in Irbid. And if you look at these outbreaks, these are the wedding that has 91 confirmed cases with a 52% symptomatic, which means that we discovered 48 only by contact tracing, half of them by contact tracing. There was a driver number 1, 6 cases only. We learned from the wedding situation from the beginning. The driver number 2, 19 cases. And why 19? Because the driver was not in Irbid, actually. He was from other governorate in the north of Jordan, not under our mandate of work. So they were exporting patients to us in the city of Irbid. Then we have a physician who came back from Spain. He managed to come back from Spain and he infected 8 of his sisters and brothers. So if you can see, we know all these foci. We know exactly who is who. And only out of 120 cases, we are not sure of 4 of them. Where did they get the disease? Well, we have some theories we cannot share with you now. How did they get the disease? But I think there are social issues that we will keep it unknown for the purpose of unknown. I can tell Salma later what are these situations. Yeah. So the message of this slide, there was no community spread of COVID-19 in Jordan, in Irbid. Actually, we did almost 8,000 PCR in the beginning of the situation in Irbid. And the percentage rate of positivity was less than 0.3%, less than 0.3% of the 8,000 PCR sample that we did in Irbid. These are the messages that I want to share with you. So if you look again at this slide, wedding, unknown 2 cases, the physician who transferred to 7 of his family members, driver number 1, driver number 2, 4 cases unknown, and the whole other periods are free. And yesterday, actually, we celebrated discharging the last patients. Also, we used the GPS system. We were actually putting exactly the numbers of cases we have taken from several villages, from the refugee camps, from the towns in Irbid. So we don't go back, or we have known exactly where we did go. So GPS for every patient, for every contact person, for everybody who we did our sample from. And just if this is in Arabic, I'm not gonna discuss this, but this is the case management. We thought there's surveillance, then there's the case management. Case management was following the national guidelines. And it was very simple, my friends. If there are 12 or 15 hospitals in the area, only one hospital is recognized to receive suspected or confirmed cases. Within 5 minutes, any physician in any of these hospitals was able to contact me or my designee. And in 2 minutes or 3 minutes, a civil defense car will be transferring this patient from that triage room, if that hospital, to his room in this JCI and HCAC accredited hospital, to his room, not to the emergency room. We have designated elevators, designated infection control way, designated path for this patient, that he will not be in any way in contact with a staff or an emergency room guy or anybody in the hospital, and everything will be taken in the wings of this hospital. At some point, we did have 200 patients or suspected cases in this hospital, which is 600 hospital. Meanwhile, we kept the emergency situation, the emergency care for any patient in the north of Jordan in this hospital, which I think is a safe haven for anybody, even with the COVID patients. Okay, we did not forget to make some research. These are the first three reports we have just published in the literature from our hospital. We are proud of our research team that we have actually every detail of each patient and contact cases. We have the data for 7,000 person who we did investigate in this situation, and I think our research that is coming will be benefiting Jordan all over and the world. One word, Salma and my friends, one word, the most important word, Salma and my friends, these are the volunteers of Irbid. The epidemiology, the surveillance teams in Irbid were 5 at the beginning of the problem. We made them 30 by the volunteers who came from Inflet, who come from the physicians of Irbid, who come from drivers, from students, from everybody who could do something. We had hundreds of people from Irbid who were putting money, putting their cars, having their fuels, their food, and everybody. Without the power of people, my friends, you cannot do anything. In this situation in Jordan, we just celebrated discharging last patient yesterday. We recognize what is the power of people when you trust them, when you share with them, when you are accountable for them, and when you involve them. You include them and you don't exclude them from what they're doing in their country. By this, I will finish by stressing on teamwork, decentralization value, the importance of good governance. Volunteering is #1, should be #1 actually, and civil society involvement. Preparedness of our health services is a major issue, and we have to work harder on our preparedness. And I think HCAC will help us do this more in the future, as they are helping us doing this now. And thank you very much. And I think I finished in time, Salma, is that right? Or I just take more time of you? Thank you very much. Thank you, Eric.
Thank you very much. And let's Salma, and we'll get the questions after both of your presentations. Please, Salma.
Yes, hello everyone, and good evening, good morning, and good afternoon, wherever you are. I'm really pleased to be here. Thank you, Eric and the IHF team, for inviting us and letting us present Jordan's story. Dr. Wail, thank you. It's the first time I listened to the Irbid story as a whole. We read the news and we are part and part, but it's really a lot of the combinations you have mentioned, the decentralization and good governance, that helped this area to be well contained and to flatten the curve there very well. For those of you who don't know the Health Accreditation Council, let me just share my presentation. All right. So for those of you who don't know the Healthcare Accreditation Council, we are a not-for-profit organization based in Jordan, established for Jordan primarily with the vision to use accreditation of healthcare institutions as a tool to improve quality and patient safety. And we have been working on that for the past more than 12 years. and we've been accredited by the International Society for Quality in Healthcare, also now known as IEEA, for all the work we do in accreditation. And I think our role has been more than accreditation. It has been really raising the flag for quality and patient safety across the region, and specifically for Jordan. And some of you live in countries where quality and patient safety, health outcomes, measurement, clinical guidelines are part of the law and are enforced by law. Jordan does have an amazing medical sector and is very proud of its medical tourism, of course, before the situation of the COVID-19. But we worked hard to introduce into healthcare institutions the continuous quality improvement approach through accreditation, raising the bar on those issues. We work with all of the stakeholders, and we work through several components, including consultation and capacity building. So during the COVID-19 situation, we were really interested in both looking at how accredited organizations versus non-accredited organizations dealt with the COVID-19. Was it were they stronger? Were they did they have more systems or more things to help them navigate through the needs of COVID-19 at the institutional level? And what could an accreditation body and a quality and patient safety body do when the whole world has zoomed into COVID-19? And our concern was really to make sure that quality and patient safety are even more important in times of crisis than on a business as usual day. So the first part of it was looking at the accredited organizations, and we went through 3 areas. We looked at a database of information that we had on institutions before accreditation, after accreditation. Then we did structured interviews with those healthcare institutions that are accredited by HCAC to understand from their perspective whether being accredited has helped them. And we also compared that to much of the data that we have from satisfaction questionnaires. We didn't go over everything. We selected 6 core areas that, in our opinion, were critical during COVID-19: emergency management, infection control, case management, the capacity of the healthcare workers, communication within an organization, and laboratory services. And we took those data that we had from accredited organizations before and after being accredited, and you would see that in all of those 6 areas, before accreditation, their initial assessment or gap analysis against the standards required by accreditation were lower than one would want, around 28%. In areas of infection control, it would be around 5%. We're not saying they didn't have anything, because sometimes you have the policy, but you don't have the implementation. Sometimes you are actually doing the practice, but you don't have the policy. Sometimes you're not communicating it. So the system, the comprehensiveness of things was not there. And post-accreditation, we had much better results with changes ranging between 66 to 92, 98% in times of adopting those standards. So we can truly say that healthcare institutions that went through the accreditation process have had stronger or more comprehensive systems when it came to this crisis and the needs of this crisis, from emergency preparedness and infection control and case management. Then we went online and we did structured interviews with quality practitioners in accredited healthcare institutions. And the feedback we received from them was very positive on the impact of accreditation. They commended the fact that accreditation helped them have structured infection prevention and control program. It helped them work with performance indicators, and the trained staff made it clearer in terms of communication. Having committees as required by accreditation helped them work together and communicate better, as well as policies and procedures and emergency preparedness. And last but not least, we looked at feedback, qualitative feedback that we had from satisfaction surveys, and it supported our notion of saying, absolutely, accredited organizations had stronger ability to respond and adapt and to the needs of the COVID-19, including the fact that accreditation helped organizations look more at their employees, at their rights and responsibilities, at their safety, and at occupational health. So that's the first part of my presentation, and I hope that many organizations would believe the same way we did, that accreditation helped institutions be in a stronger place. What did we do in order to support the healthcare sector in Jordan? We designed 3 approaches. An awareness campaign, and online training sessions, and a preparedness toolkit. We launched a Be Ready, Be Safe awareness campaign, and we directed it mainly to hospitals and healthcare providers. Unlike many of the communication campaigns that were all over internationally and locally, they were directed to public at large, what to do and how to act. Ours was more focused on how to deal better in emergency response, in case identification, in supplies management and information management while upholding patient rights and so on. And this campaign ran for a month, and for every message that we had out there, people could click on a link and go to a more detailed recommendation on how to deal with things. And we had very, very good feedback, even from non-accredited organizations who became very interested to use this information within their organizations. We also launched an online educational sessions on our eJawda platform, and we dealt with things for quality and patient safety beyond the organizational level, such as neonatal care for mothers, or how to deal with intensive care for patients, mental health care for providers. So we focused less on the information that is disseminated for public at large, and we addressed issues related to healthcare institutions. And last but not least, we designed a full-fledged toolkit and a hospital readiness checklist that includes information and easy to access what to do within the halo of COVID-19 on issues related to patient care, medical lab, blood banks, diagnostic services, to ensure that everything is in place. And that was all accessible through our website. And it was all free of charge to make sure that the health sector has a full access to their needs to be more ready, and we call it readiness of the health sector. So I'd like to wrap up at this point and say, for us, the readiness of the health sector, we think it was helped by being accredited, and we helped as well by designing all of those tools and making them accessible. The message is, although we get drawn to the needs of responding to the crisis, we should not in any way sideline or put on the back burner all the issues related to quality and patient safety. And thank you very much for listening to this presentation. I look forward to your questions.
Thank you very much, Salma. And it's great because both of the presentations, they mirror well each other, because on one side, we have seen how the local response is very important. And on the other side, we see also how it can be useful for the sector to have a body at national level that prepares support that is useful for all the community of hospitals. While we are waiting for questions, there is one that was put ahead of time by one of the participants, which is about what's next. You know, we have heard all the great stories on how you have responded, how you have organized. How do you think these responses you have made in this period of crisis are going to sustain over the period of crisis? What is next? What is the next normal situation? What are your priorities? How much are you going to sustain what you have put in place in terms of transformation to respond to the crisis? So, go ahead, Professor.
Thank you. This is a $1 million dollar question. As I told you, our containment process has provided us with a lot of challenges. If you ask me as an infectious disease person in Jordan now, I tell you what's the seroprevalence of COVID-19 in Jordan, I will tell you it is 1 digit, 2%, 3%, 4%, I don't know, maybe less than that. So we don't have herd immunity, just like many other people don't have herd immunity in the world, or mostly everybody in the world. Every country doesn't have herd immunity. And I think my friend is now our main challenge in Jordan are our people who are returning back. At one side, you cannot deprive citizens the right to come back. On the other side, you don't want to endanger what is happening in Jordan. So where is the solution here? And I think more and more we are realizing now and learning that social responsibility is very important. It seems that what people are doing around the world of social distancing, adhering to PPIs, maintaining high obedience and high commitment to using alcohol-based hand rubs, social distancing, gloves, or mask is making a lot of difference. So I think our main challenge now is to keep our people in Jordan to the point where they believe that these are very important, because we are coming into winter and there will be a lot of influenza and there will be a lot of confusion between COVID and influenza. So next step, sir, as we have the roadmap in Jordan, is to strengthen our surveillance process, especially on the borders. And this is a big question we have to solve, how we can do it. We do it now by PCR. Maybe in the next step, we will do it by serology. This is something the other committees have to make the decision. At the same time, I think we are now gonna be doing a lot of communication campaigns to increase the adherence of our people to the social distancing procedures and measures. And at the same time also, because we don't see cases in Jordan, people started to feel the conspiracy theory around this disease. And this is a very big challenge to our people in Jordan, to civil society, to the government, to the institution, public and secret. So I think we need a plan to combat this process, so we don't get entrapped in this problem. So we have, yes, the challenge of the interest, the challenge of the people keeping their adherence to the measures. If we manage to do these things, I think Jordan will be able to pass through. And our eyes are on the new medications, our eyes on the new vaccines that might be available in several months. Bigger question, these are what we think over this point, but we don't know what's gonna happen in the next few weeks.
Thank you very much, and I'm sorry I just got disconnected at a point, but I guess you were able to continue the flow of the conversation. Salma, anything you would like to add?
From our perspective, the next phase is also very important. As you know, we were caught off guard with what happened in the first round. And God forbid, but reality is reality. There might be another peak, there might be another wave before we are able to really have either a treatment or a vaccine available. And as Professor Hayajneh mentioned, the possibility of the second wave is going to come mixed with all the other influenzas that happened during the fall season, fall to winter season. From our perspective, we have designed systems to support healthcare institutions to be ready. So whether the government takes a lockdown approach like it did, or not a lockdown approach, but a more conservative one, whatever the decisions are based on the numbers and so on, healthcare institutions must be very ready to deal with those cases, with screening, with community outreach, because Dr. Wail mentioned very much the success of the intervention of the civil society, and primary healthcare centers are at the core of the education and the service provision for the communities and the people, and they have community health committees that should become very active. So from HCAC's perspective, we have designed tools and programs to support primary healthcare centers and hospitals and standalone centers to be able to take its precautions, but as well play a role in awareness and safety and infection prevention at the community level. We're hoping there will be a good uptake, because Dr. Wail mentioned something very important, is that with the fact that we have very low cases, we are a little bit now feeling on the safer side of things. So we hope we don't let our guard down and get ready for the next wave when it hits and if it hits.
Yeah, thank you very much. And this is giving a comprehensive picture on, the uncertainty and how to prepare to face this uncertainty we have ahead of us. But I want to come back to the aspect of the transformation. You have put in place, because of the crisis, a certain number of new modalities of work in the region of Irbid, or somehow you may have enhanced some of the mission of your organization at the level of the Jordanian Council of Accreditation. How much do you think this will sustain whatever is going to happen? Because once you have created these new modalities, you can also create a new expectation from the people you are working with or you serve. So how much do you think some of the transformations will stay, whatever is going to happen, whether we are going to deal mostly again with non-communicable disease as the major burden of disease? How much do you think some of these will stay and will be part of a long-lasting transformation, and which one?
Okay, Salma, me?
Go ahead, Professor. Let's do it systematically this way, in the order of the, so that we don't get any trouble.
Thank you. Thank you. Well, the one notion that I want to tell and say that, and I think Corona after, the word after Corona is not the word before Corona. We have learned during this crisis that we are all together, whether we like it or dislike it. That no nation in this world can manage without others. And you have seen huge, big, advanced countries collapsing with this in this process. So I think as institutions, as individuals, as governments, and as public people, we have realized that there's something that has to change. And this is, I think, country specific. This is very country specific. And I can't talk about Jordan, maybe others can talk about other countries. So we have in Jordan certain habits, social habits, religious habits. Well, religious, I mean, we stick to it, not necessarily religious to start with, that we know now. We know now that they're wrong. You know that men in Jordan, they kiss each other? Well, this is a very, very, very important habit in Jordan. Do you know that we eat sometimes from the same plate? From the same plate. Where we smoke, we have argila, habli babli, in closed areas, So there's something that has to change. And I think people are ready to make the change. As long as our leaders are ready to ring the bell. And I'm talking about leaders, I'm talking about institutions, I'm talking about civil society, I'm talking about the government, I'm talking about religious leaders, social leaders, HCAC, other people. And one of the lessons I learned that people are willing to hear if they think they are being respected, they are being part of the change, they are being included and not excluded. They are participating in the good and bad, not only in the good. So I see these changes in Jordan. Honestly, I wanted them to see them more and more realized, but I think they're coming. But leaders have to get in and start ringing the bell. Salma, you have to add anything?
Very quickly, I want to say that how many years and years as healthcare institutions you've been trying to push hand hygiene within, and even in the best institutions in the world, we never achieved the higher numbers. And now with this COVID-19, hand hygiene, even with healthcare professionals, has increased. So we are hoping to build on this momentum, Eric, and use this momentum as a showcase to success and what we can do. So the laid-back approach that we had could now benefit from this crisis in hindsight and move forward on the implementing things and compliance from our perspective to quality and patient safety issues in a stronger movement forward, inshallah.
And so while we see, how this crisis is changing a number of modalities, there is also the question about taking care of those who have other healthcare issues, while responding to the COVID crisis. And there is a specific question coming to us about how accreditation can help to better handle the fact that we should not lose track of other healthcare issues while responding to COVID.
It's for you, Salma.
Yeah. Well, the part on other diseases, I think this is where we are waking up now. What I said earlier is that we were caught off guard. We as Jordan, we were caught off guard with the needs of to respond to COVID-19. And yes, we did, by closing down primary healthcare centers and so on, somewhat, we only sent a message that only emergency cases is what we are caring for. But slowly the government started realizing the need to continue on all our programs, from immunization of kids to reproductive, maternal and child health services. So I think that has been taken care of. Learning, we had to learn from a very steep curve. However, from an accreditation perspective, not just the term accreditation may be very, very stringent, but we have programs for breastfeeding, for diseases such as diabetes and cardiac care and so on, which we hope that if organizations adopt, that will always keep them within their eyesight so that they continue to provide those services, screening for breast cancer, for example, and so on. So I think we should grab the opportunity to plan for the next time we have the COVID-19 crisis or any other crisis. We really, really have to learn from the past few months. And if we don't, it will be an extremely missed opportunity for Jordan, the healthcare sector.
Yeah, Salma, if you allow me for one comment. And I think, yes, we were caught off guard, but at the deep unconscious, the deep subconscious level, a hospital like King Abdullah University Hospital, which is accredited by JCI and CAC, we did have policies before how to deal with such cases in such pandemics. And I can tell you from numbers, and I think this is a research thing you can maybe initiate it. We did. Our hospital was the only recognized hospital to deal with COVID in North Jordan. We did surgeries, CATs, emergency CATs, a lot of things, more than any hospital in the area. So yes, we were caught off guard, but for other things. But I think accreditation by itself was a matter of preparedness.
Thank you. Just a last question before we close to you, Professor, is about the social immunity. This is something that has been flowing around. Can we think that anytime we will reach social immunity, with the COVID, or this is some strategy we should never think about?
Well, I'm not sure what do you mean by social immunity?
No, I think the question is the group immunity.
Herd immunity.
Yeah, it's herd immunity, I guess.
Herd immunity.
I don't think anybody will reach herd immunity. And it is how you define your herd immunity. Sir, if you go down to statistics and epidemic curves, it is estimated that you need to infect 50 to 60% of the community with COVID-19 in a situation where there are no measures, in a situation where everybody is naive or susceptible to this disease. What happens now in our communities that with being strict with social distancing, with gloves, with masks, you are decreasing the number of needed infected patients or infected people to reach herd immunity. So if the community is really taking care of itself, they are practicing these measures, maybe you need to have 30 or 40% of the population infected to reach that herd immunity, or even 25. Look at certain, why is the curve going down in many countries around the world where herd immunity is not reaching 20 or 25%? And I think this is people's action, people's being strict with the social distancing. And I think that's what we have to gamble on now. Well, this is a dangerous gambling, but this is the situation. So herd immunity in terms of numbers, 50 to 60%, I don't think we will reach it. Herd immunity in terms of decreasing, of increasing our social distancing and our preparedness, I think this is maybe reachable.
Thank you very much, and it's complementing very much the previous comment from Salma about good habits that people really have integrated. Let me close down the session with a few takeaway messages that have identified through your presentations before I give you back the floor and we close totally this session. First, clearly, a crisis is an accelerator toward decision-making at the level of where it happens. And this is a very important lesson from this one, is that you really need to have decision-making at the level where it happens. The second one is decentralization is a unique opportunity to break down the silo and to work in multidisciplinary intersectoral work at the level of where also the population is. The third one from your experience in Irbid is that the lockdown is effective when it is highly targeted. and the clustering approach, you have put it really in place with very rapid reaction to the clusters. The fourth one is that quality and patient safety should never be out of sight. And it was very interesting to see how much accredited organization, because they have processes and practices, and you both mentioned that in place, are much more prepared to face crisis and unexpected events. And the next one is that the bodies, national bodies that are in charge of quality insurance accreditation, have an important role to play in such situations by putting in place recommendations, education, and tools, because at some level it's not necessary for each to reinvent the wheel. The last one is about the success that you had in flattering the curve. It is about acting very early and very massively at an early stage. So it's not only to be quick, but also to be, putting all the efforts. But however, in a country, we are surrounded by other countries, and the fact that you are somehow doing much better than what's around you is still putting the country at risk, because we are, in regions, and we have to live with the exchanges with other parts of the regions, and that remains an unmet challenge, and that is ahead of us. Professor, do you want to have a final remark? And we'll close really with Salma.
Yes, thank you, Eric, being so nice with us. Let me finish with this remark, and this is for every person around this globe. Always remember to unleash the power of people. People have a lot of innovations that can help us in solving any problem. And this COVID-19 crisis was a flourishing example of this truth that we sometimes ignore. Thank you, Eric. Thank you, Salma.
Salma?
Thank you, Eric and IHF for this opportunity. Thank you, Eric, for summarizing the discussion. You really had specific points. And thank you, Dr. Wail, for being there, as well as the unleashing the power of people message, which I second, and it's very hard to follow on from your recommendation. But I would also add, let's learn. It's very important to learn from what happened and use that learning for the next phase. Even if it doesn't have a crisis, there are many learning opportunities in what has happened. And let's always put quality and patient safety as an integral part of every decision that we make in the health sector. And thank you, everyone, for joining in.
So thank you, everyone, and this has been a very interesting and interactive session. Patricia, a last information about this webinar and the coming webinar.
Yes.
Thank you all.
Eric. Thank you, Eric. Thank you very much, Dr. Wail and Salma, for all that you have contributed to today's webinar. To everyone, we still have another webinar scheduled next week. The Canton Hospital of Freiburg created an operation center that fostered a central decision process and structure and standardized processes to gather real-time data. Hear about their development based on design thinking to create operation center, the center's core elements, and the escalation plan and its effects. If you'd like to join us there, please just register at www.ihf-fih.org/webinars. I hope you all have a lovely morning, afternoon, or evening ahead of you. Please stay safe and healthy. Together we'll overcome this crisis. Thank you again for joining us today. Dr. Wail and Salma, thank you again for your contribution.
Thank you, back.
Bye, everyone.